and we'd like to introduce all of our panelists at this time. At the federal level, we have Congresswoman Sylvia Garcia, who represents parts of Houston, Galena Park, Jacinto City, and Pasadena. At the state level, we have Senator Cheryl Alvarado, who represents Southeast Houston and portions of Pasadena. And also locally, we have Houston Mayor Sylvester Turner, who is fresh off of a news conference here. We appreciate you joining us. And also joining us this afternoon is Dr. Layla Walk Colburn, an associate professor of medicine and the director of medical education at the Baylor College of Medicine. Thank you all so much for making the time for this very important discussion. I'm going to go ahead and start with Congresswoman Garcia and give you all an opportunity to briefly introduce yourselves.
Well, first of all, thank you so much for hosting us tonight, and thank you to all the panel members. I've worked with the mayor on a number of issues and known him a long time, and he's certainly doing a super job of getting us through this pandemic. And Mayor, thank you for doing this tonight. And State Senator Cheryl Alvarado and I have obviously also known each other for a long time and worked on many issues. And my new best friend, of course, is the doctor. I mean, she's just been really super in joining us in all of these town halls, particularly the Spanish language town halls that I have hosted, because it's so important to make sure that we reach all our communities. And I think that's what's the important message I would like to leave tonight. As I work in Congress, it's always about for the people, making sure that working families and people have the resources, that have the medical care, that have the access to health care that they need. This is something that, you know, this virus does not discriminate against anybody or any neighborhood. It really hits everybody. So we can only work on this together, and it starts with us. We need to be responsible. We need to follow the orders of the county judge, Lena Hidalgo, and the direction of our mayor to stay at home, to take care. And if we go outside, we need to do it only if we absolutely have to, and if we do, to wear a mask. We need to make sure that we work through this, to make sure that we all get to a point where anybody who needs a test can get one. Anybody who wants to go back to work, we'll make sure that their employers are ready to receive them, and that they're safe, and that they're going to be taken care of. So I'm just really pleased to be here tonight and working together with all our local elected officials. We will get this through this together, because we are Houston strong.
Thank you so much. Senator Alvarado, please, a brief introduction.
Hi, good evening. It's good to be with you. Thank you to HDTV. And I want to give a special thanks to Congresswoman Garcia. She's been organizing so many of these tele-town halls and Facebook Live town hall meetings. Very much appreciate her organizing it and bringing so many of us on. And of course, to the good doctor, thank you for your work, and to all of our people that are working in the healthcare industry. Mayor Turner, we were all just together yesterday. Thank you for your leadership in getting yet another testing site. This one, we're most appreciative because it's in our district, in my district, in the Congresswoman's district. But more importantly, it's in an area where we know that people are vulnerable. There's a large concentration of Latino families and African-American families. And as you know, the number of deaths that have occurred, the majority of the folks are from those particular communities. One thing we've all been united on has been testing, testing, testing. The more testing that we have, the better idea we have when we can get back to some sort of normalcy. The testing is crucial, having access and having quick turnaround of results. I know that Governor Abbott is slowly reopening the state, and I hope that we can talk about that as we get into the program. But thank you for having me, and to those at home, we hope that you're doing everything to stay healthy and to keep informed. Also, be mindful of people that are running scams. We know that as these checks are coming in from the federal government, there may be some sort of scams that people are getting hit up with. Make sure that you're getting your news and your information from very credible sources, either the newspapers or from your local elected officials, or of course the mayor's office or Judge Hidalgo's office.
Thank you, Mayor Turner.
Thank you, and also let me give express my thanks to Congresswoman Sylvia Garcia for the lead that she has taken in putting this event on. And again, we were all together on yesterday, and so let me thank you, and let me also thank the Congresswoman for the support that she has given to all of the cities, but specifically to the city of Houston, with the federal assistance and the federal dollars that have been sent here. Because of her effort and the efforts of so many others, $404 million are now sitting in the city of Houston's account, specifically to put together strategies and programs to combat COVID-19. So a big shout out and a big thanks to the Congresswoman. I certainly want to acknowledge and thank State Senator Cheryl Alvarado. She's been a huge champion for the city of Houston and in her work at the state level, and look forward to continuing to work with her on these particular issues. So thank you so very, very much, State Senator Alvarado, for work that you have done and what you continue to do. To the doctor at Baylor, I can't say enough for them. Baylor College of Medicine has been really at the forefront on this particular issues, the work that they've done, all of the testing and trying to find a vaccine for this particular pandemic. So I do want to thank Dr. Coburn and all of her colleagues at Baylor College of Medicine. And then I want to thank the people in this city. I want to thank you for your cooperation. Judge Lena Hidalgo and I have asked people to make some huge sacrifices since the first part of March, and people really have done that. We've asked you to stay home. You've done that. We've asked you if you were an essential employee of an employer to work safely. You've done that. We've asked you to engage in social distancing and then to put on your face mask or your face covering. And because of your collective efforts, Houston has fared relatively well. When you take a look at the other cities that are much bigger than we are, we're the fourth largest city in the United States, but yet our numbers are not nearly as big as New York City or LA or Chicago. We have about 3,400 cases right now in the city of Houston, people who have tested positively. As of today, 50 people have lost their lives to COVID-19, and a large percentage of them have been African American and Hispanic. And so we're very sensitive to what's taking place in our vulnerable communities, communities of color, very sensitive. But I do want to thank people for what they have done. And then lastly, what I would simply say is that this virus is still present in our community. We don't really know how prevalent it is without doing much more testing, and we need to do a lot more testing. So we know it's in our communities as we move forward. Let's just move forward slowly and cautiously until we know this virus is out of here. I look forward to participating in this panel discussion.
Thank you, sir. Dr. Watt Colburn.
Good evening. Thank you for having me. And I appreciate my thanks to Congresswoman Sylvia Garcia. It's been a pleasure to be able to serve the Latino community, not just because, speaking in the language and the culture. Senator Alvarado, as well as Mayor Turner, we've met in several occasions here in the Texas Medical Center. I would like to thank not just my colleagues, but everybody who works as a first line responder as well here in the hospital, from the person who does our EVS, to our nurses, to our PAs, to our microbiologists, and people that just help us every day. And to thank everybody who's done food donations. I am trying to keep my weight down, but everybody's very appreciated. I think I'm eating my 3 meals plus something, but we like that and appreciate how the community has come together to help us work and doing the social distancing. So we know that is very difficult and it has been hard, but I think we're able to flatten the curve to a point where we can help each other. Thank you.
Wonderful. Thank you all. And we're going to go ahead and get started. The way this will work is I've got some questions for each of you. I will start with the Congresswoman, but to the viewers out there watching live, please text your questions below in the comments and let us know who you would like us to ask them to, and we'll make sure that we direct that question their way and that we get that addressed for you. So we're going to start off with some questions I have here, and go ahead and as you hear the responses, begin to post comments and questions on the Facebook feed, and I've got my setup here on my computer to get those questions to our panelists this evening. First, Congresswoman Garcia, let's talk about this stimulus package. That is, besides unemployment, which we will get to as well, the stimulus package, regardless of what situation people are in, a lot of them are still asking, where's my check? What's the delay about? Can you tell us up there in Washington, what's the holdup for people still waiting?
Well, let's start from the beginning. This package is a relief package, and every adult, depending on their income, will get a check. And we have already sent out 88.1 million people a check, 88.1 million adults. And just think about it. There's only 209 million adults, so that's almost half of the adult population has already received a check. It started with those people that already had a direct deposit on file with IRS when they filed their 2018 or 2019 return. Those were the easiest ones to do because they already had a direct deposit information online. So those have already gone out. Last week, they began doing the paper checks. In other words, physical paper checks for those people who either did not file a return or did not have a direct deposit. So those started last week. I think they're doing like 10 or 12 million a month. And then there's going to be another batch that we're going to have to deal with of people who didn't file returns but were qualified, or they either had a direct deposit in their 2018 or 2019 tax return, but they've changed banks. So that'll be the third round. So slowly we're working through it. But I think the important thing is this, is that we are sending checks. I would have preferred a much larger check. The Democrats were pushing for $2,000. Mm-hmm. It was compromised at $1,200. We would have preferred to continue the checks on a monthly basis throughout the duration of the pandemic. We had to compromise. It's only a one-time payment. But the good news is this, we are getting help for some people, including those on Social Security, on veterans benefits, on retirement benefits. So people are getting a supplemental income. And we hope to, in terms of Democrats, to get in the next package a continuation of this, or to do more for the unemployment checks, because as you know, there is a $600 a week supplement to the unemployment insurance check, which is a big help, because in addition to the stimulus check, they can also, if they're unemployed, they can apply for unemployment in this state and get that check plus the $600 supplement. So in all, I think we've tried to address some of this. The only thing we haven't done yet, and we're still working on it, is rental assistance, because obviously that is huge in many parts of my district and many districts across America. I know this is a concern for the mayor also, and we will continue to try to address that. So if you haven't gotten the check, you can go to the IRS website, and there is a portal that you can look for the status of your check, or if you want to give them your direct deposit information, there's a separate portal for that. And again, you could do that through the irs.gov website.
What kind of help will there be for immigrants who will not be receiving a check?
Well, that has been a hurdle for many of us, and I'm one of those who advocated that we at minimum should give the same stimulus check to those people who have contributed their taxes through a temporary income tax number. It's called the ITIN number, but it just means that they get a temporary number that paid in their taxes, but yet they were left off the list. In fact, even people that may be married to an immigrant, you could be a citizen, you're married to an immigrant, those people are also not eligible. Those were all, frankly, decisions that were made by the people that are implementing the rules. They weren't going to try to fix that and change that, because I think anyone that's paid in deserves to get back just like everybody else. But we are providing assistance to food assistance grants to the food banks. We're providing a lot of dollars to the community health centers to provide medical care. So indirectly through helping those programs that are serving everyone, particularly like here in Houston, in Harris County, all our community health centers through the Harris County Hospital District, the city of Houston, they're helping everyone, because the virus, as I said earlier in my opening remarks, does not discriminate. It's impacting everyone. It will do us no good to help one community and not everyone, because then you're not doing anything to really contain the virus. So same should be for any help that we give. If you help one, you need to help all. Otherwise, we may be back to square one. So we'll continue that fight, and we'll continue to make sure that everyone is covered, not only through testing, but treatment and ultimately the vaccine, and that they're able to access that for free. And I think that is something that we need to accomplish to make sure that we reach our goal.
Great. Thank you so much, Congresswoman. This next question here for Senator Carol Alvarado. Let's talk unemployment. So this is a hot topic across the country. And yesterday, Governor Abbott announced that the Texas Workforce Commission more than tripled its staff to handle the nearly 2 million applications. And there's still hundreds of thousands that have not been complete yet by the TWC. What is being done by your office to make this process smoother and quicker?
Well, the entire body of the Texas Senate has sent over some of our employees to get trained to be able to help with the call volume, and to also help with reaching out to people where perhaps they're on their application, there's information that was lacking. That was a project that the entire Senate took on. The Texas Workforce Commission has contracted with the private sector to have several extra call-in centers. They've also brought in people from other state agencies and auditors from the Workforce Commission to be trained to be call takers. It's an unprecedented amount of calls and applications that have been received. The record they hit in one day was 1.7 million calls that were placed into the Workforce Commission. I do want to remind people that there is now a schedule, hoping that this would help to alleviate some of the busy signals or the no answer signals that people receive. But if, for example, if your area code begins with a 7 or an 8, your time to call is a Tuesday, Thursday, or Saturday from 8 to noon. If your area code begins with a 2, your day is Tuesday, Thursday, and Saturday, 1 to 5. Of course, you can always call 7 days a week, 7 to 7, between those hours, to the Workforce Commission at 1-800-939-6671. You can also go to the Texas Workforce Commission at www.twc.texas.gov.
Thank you so much. We have some questions coming in now from people viewing, so we want to get to those, and we have permission to use their names, so we're going to do that. Question here for Mayor Turner. Kathy Dupree wants to know, how are we going to improve testing in the city? I know you just announced today another testing site tomorrow. What else is planned down the road?
Well, I would tell you, and we do need more widespread testing, no question about that. Now, we have doubled our testing capacity at Butler Stadium and Del Mar Stadium. So those testing sites are open, and they're open to everyone. On yesterday, we opened the site at Barnett Stadium. And again, all three of these sites are for people, whether you're symptomatic or asymptomatic. You don't have to have any symptoms, and you can come. They are free, and they are open to everyone, every and anyone that's in our city. And then we are opening up 3 mobile testing sites. One will be at Kashmir, Multi-Service Center, Hiram Clark, and tomorrow we will be opening up a mobile testing site in Sunnyside. So we're trying to provide these testing sites in many of our vulnerable communities. But we want them to be widespread, and there will be others that will be coming open. So again, I would encourage people, come, doesn't matter whether you're symptomatic or asymptomatic, doesn't matter whether you're documented or undocumented. These are free testing sites, and that's the best way for us to get our eyes on where this virus is. but at Del Mar and Butler Stadium, we can test up to collectively up to 1,000 people, and so we want people to come out.
All right, Mayor Turner, we know that Governor Abbott announced a new course of action to begin reopening businesses in Texas. He also announced that his order supersedes all local orders. And so we have a question here from Matthew Roberts asking, is that stay-at-home lifted for Houston proper, and what part of it will stay in place following that announcement?
Well, the stay-at-home order still remains in place, even on the governor's order. But there are certain exemptions, certain things that he's opening the state up, for example, for retail, for restaurants, malls, movie theaters, and that's still with the limitation of 25% of their occupancy. And other than the other things that he mentioned 10 days ago, you know, if you read all three of his executive orders, he's still saying stay at home with the exception of these things. Same thing with the city of Houston. Our orders will match up to the one that the governor put forth. And I will tell you, we're still encouraging people to stay home. We're still encouraging people to engage in social distancing, wear their face coverings, their masks. All of those things we need to continue to do. This virus has not left the city of Houston, hasn't left our area. We still need to be very, very careful. And so let's move forward, but let's do it carefully. Otherwise, we could face a resurgence of this virus, 3 to 4 weeks down the road.
Thank you, Dr. Watt Colburn. This question for you. What do we need to see from a health perspective in your experience before we open up the state of Texas for business and go back to work?
So in order to open slowly, the state of Texas is kind of the key things that have been already done. One is increasing the testing capability. You really want to have ways to test, and that has been started. Just like Dr. Fauci said today, we are going to see more cases in the upcoming weeks. What we don't want to see is an upsurge. The social distancing or partial social distancing is another must. I mean, our new normal is not going to be like it was in January and December. We still have to watch because the virus is still in the community, and as we interact with more people, we're going to see that. Another part is going to be a big part from the public health perspective. Once we identify someone who's positive, is to trace it and isolate so that doesn't spread anymore. And that's what Harris Health, as well as the City of Houston Health Department, has been doing. So testing is the key point, but it's also asking the public and everybody else to, we are not going to go back to where we were in January, but slowly ease into it.
Doctor, are you concerned about a second wave?
Yes, of course I am. I am concerned because, history repeats itself. And so our biggest pandemic that we had was influenza in 1918. And when you look at the curves, once the social distancing and the the public health measures were open up, we had that little part and then a big surge. And, that actually happened a couple of times. I actually seen it right now with the countries that were hit first with the COVID-19. For example, Singapore, as well as Japan and Taiwan. And where they have done is, as they open up, is test and isolate and track those people. That is, as New Zealand is preparing to do the same, as they have said that the cases are almost zero, is where it's going to be imported for example, in that island. But for us, it's people coming and making sure that we can identify.
All right, thank you so much. We've got another question in, but before we go to that, I'm going to go back over to the senator. Perhaps you can answer this. We know the state is reopening some things. We've gotten a lot of questions about state offices, such as the Department of Motor Vehicles. And will there be an opportunity for people to stand in line again at the Workforce Commission?
Not at this time. We urge everybody to go online. For example, if you're trying to get your driver's license or your vehicle registration, some of those deadlines or expirations have been extended until further notice. We certainly don't want people going to any state agency and going in line. That's not keeping social distancing. But we urge everyone to visit the Texas website, which is texas.gov, and you can go online if you have to reach any state agency.
Thank you. Congresswoman, Sandra here is asking, will there be another stimulus package? Will there be another check? I think you partially answered that, but if you could reiterate.
Well, again, our hope had been, in terms of the position of the House Democrats, was that we continue the monthly check through the duration of the pandemic. And the way that we wanted to measure that was when we got back to an unemployment rate to equal what the unemployment rate was at the beginning of the pandemic, a real barometer, if you will, to tell us when we were really back, into somewhat of a normal, but that was not agreed upon. So we'll continue to fight for that. Having said that, I think we will probably have another package because small businesses are still hurting. It's my understanding from all the information I have, we just started the new a release of funds from the last package that we passed last Thursday, and they're almost already running out. They'll probably run out by tomorrow or before the end of the week. So we're going to have to go back to the table. And my guess is there will be another relief package, and I'm not sure that it will include a individual payment check, but it may include lengthening the time and extending the time from the unemployment supplement. And it might include more dollars for the small business loans and more dollars for hospitals to deal with the pandemic, and more dollars for research. Remember, research is also very, very, very key. That was part of the first package. And we need to make sure that they've got enough research dollars to get to the vaccine and something that we can do long-term. And I'm told, and the doctor could probably help me, that it usually takes about a year. They're trying to fast track everything, but my hope is that we can fast track and that we can do it sooner. But we'll continue to look at it. We're not going to allow people to hurt. We're going to make sure that our government stops at nothing to make sure that we can keep people home safely, that they can go back to work and play and go to church and go to school safely, and that anybody that needs a test can get a test. So again, it's about testing. I don't think we can go back to a full recovery until we have a robust test program with great coordination with all our employers to be able to go back to work.
Okay, I'll get back to you in a second. Congresswoman, we have a question here for Mayor Turner.
Okay.
What is being done to ensure that we don't evict people during this pandemic? A lot of people, we know that there's been a halt on them, but a lot of people are getting notices to vacate and they're getting very nervous.
Right. Let me just say, and I certainly appreciate it when the Texas Supreme Court halted evictions until the end of April, and I think they've extended it now to May 18th. They would be extending it for the entire duration of May, because we know that for many people, May is going to be more critical than April. And then before City Council this coming week, I'll be putting forth a proposed rental assistance program to provide some assistance to people who are hurting as a result of COVID, directly as a result of COVID-19. And it will be specifically for those individuals who have lost their jobs or income and find themselves in a precarious situation directly because of this virus. It won't be nearly enough. Of course, we need more support there. And then, but hopefully, with what we plan to do here at the city, and then combined with the contributions coming from the private sector, from endowments and philanthropists, hopefully we can help to ease the burden for some of the individuals and families that are out here.
All right, thank you so much. This question for Dr. Colburn. A lot of people have been writing in and asking after President Donald Trump's comments regarding disinfectants and sunlight and heat, and those as possibilities as being effective on COVID-19. And of course, we know at this time that he walked those comments back. Would you like to shed some light on that at this time? Because we know that there are people in the public who don't quite understand that. We get the questions every day. What do they need to know about those comments and how they could impact their health?
So, President Trump made some remarks about UV light and the use of disinfectants. Those work very well on surfaces. They don't work very well if you ingest them. And we have had from food control places where people have actually ingested the Clorox, and actually ingesting it, it's gonna kill you. So disinfectants and the UV light work great on surfaces. They don't work great when you take them. People, just like they said, we have, like Senator Alvarado says, you have to be on a reliable source. And the NIH came out with treatment guidelines or presumptive treatment guidelines. Unfortunately, everybody wants a cure right now. We don't have that. For example, when we had HIV in the 80s, it took us a while to find something. And this virus is only 120 days old, and we have done amazing things. We know what doesn't work and what things work. 80% will do better. I've been here in a COVID unit in the medical center taking care of some patients, and some don't do as well, but others do very well. We have clinical trials of proven medicine that works right now. So what we do want is people not taking things that are going to be harmful to yourself. Use them to wipe surfaces. They work great on surfaces.
But still today, there's not any product out there on the market or any kind of service that will kill COVID-19 in your home, correct?
In your home, you can use disinfectants. You can use Clorox, and you can have alcohol over 70%.
Will that kill it though? If it's on surfaces in your home, can you use that and be confident that that surface is disinfected?
Yes, yes.
Okay.
We use those disinfectants. That's the whole idea. And we actually use those to clean our rooms in the hospitals, including ultraviolet lights that we use to disinfect our rooms with multi-drug resistant bacteria as well as viruses. But as I said, it's not something to take in.
Thank you so much. This question here for the Congresswoman from Sandra Deshotel. And then I'm going to follow it up with something for the mayor. She wants to know, is there a way we can require employers, is that legal, to test employees before returning to the country?
Well, right now, I can tell you that is a proposal that we will try to pass or to make sure that it's added on to one of the relief packages to make a new OSHA requirement that employers take steps to make sure that all their employees are either tested or use the protective equipment, depending on the employer. But I think that's a really important question, and I'm so glad he raised it, because frankly, that's one of my concerns with the governor's order press conference yesterday, that he did not really tell us what plans are being made with all the individual employers. Have they submitted plans that have been approved? What criteria have they used? I think everybody deserves the right to be able to have some comfort level that when they go back to work or go back to church or go back to school or go back to a park or any other facility, that they know that all steps have been taken to ensure for their health safety. Whether that's taking the temperature, whether that's doing the test, whether that's wearing the mask, protective gear, I'll let the doctors tell us that. But we've got to make sure that employers do that either voluntarily, and if they don't, well, then we'll have to step in and make sure that we do it through our local health departments, our state health departments, or through OSHA requirements. Because this is a new normal. We cannot just rely on, a shot like we can with the flu. We
Mhm.
don't know if somebody next to us has had a flu shot, but we know the flu shot's available. So
Mhm.
until we get to a vaccine that we have some real reliability to, we're going to have to take precautions. So, uh, to answer his question, there's nothing right there now that I know of that mandates employers to do this. But
Mhm.
if they don't do it voluntarily, we may just have to do it either through a OSHA, state health department, or local health department rule. And I would frankly like to see what the doc says about that, because I think it's important that people have a comfort level about where we are. Because right now, the reality is Texas is still 49 of 50 states in per capita testing, but yet we're opening. I still get reports every day that top positive tests are on the incline, going up. That we're having more and more cases in all our counties, but yet we're opening. And I still don't have a comfort level that I know that all these retail shops and restaurants have submitted plans that have been approved pursuant to data and the doctors and the scientists saying it's okay. So I'm still troubled by all this, and I share his concerns, and we'll do what we can to make sure that we can provide the comfort level that people need to go back to work, to play, to church, or to school.
Senator, is there anything that can be done at the state level, since the governor has proposed to begin opening businesses? And he did mention yesterday that he is quite excited about the recovery rate and that it seems to be catching up to the rate of deaths we have here. On the state level, are you comfortable with this? And what can be done to secure testing? Is that even possible?
Well, I share the concerns that the Congresswoman just mentioned. We do want to see our economy jumpstart, but we have to be cautious about it. The only thing that was outlined in his announcement yesterday, or that I've seen in his orders, there is some very specific things for nursing homes to follow. There are, I think, 8 steps they have to do, but there hasn't been anything given to the private sector. So my hope is that with many of us weighing in, hopefully he'll have something to announce at the next press conference. But I agree, there has to be something in place. And, even for our own offices as state government employees, we are looking at steps that we have to take. We have public hearings and things that will have to occur over the next several months. And how do we do that? And how do you take public testimony? Is everything virtual? We're looking at that on all fronts.
We're talking about testing here, and not to call you out on this, Mayor Turner, but I understand you are proposing a challenge to businesses reopening in Houston that has to do with testing. Would you care to elaborate on that?
And I have issued a challenge, and quite frankly, the challenge was issued to me by ZT Corporation. The CEO is a guy by the name of Tashib Badar. He has about 1,500 employees,
Mm-hmm.
and the CEO and I were talking, and he was saying, "Mayor, I know you're calling for more testing. It needs to be more widespread, more robust." And he said, "I know that you are limited from a public perspective and how much testing you can do." But he also said, "Look, I want to open up. I want to get back to business." And so it's in our best interest to test, to provide more testing. So as the CEO, I will take it upon myself, my responsibility to test all of my employees at my cost. Won't charge them anything because I want to open. And I will challenge other CEOs, and Mayor, I'll challenge you to join with me in this effort. And so he stood with me at a press conference a couple of weeks ago. Since then, I have issued a challenge to several other companies as well. Amegy was one, ExxonMobil was another. That was a third, I can't recall right now. United was a third. And some of these other companies have accepted this challenge, and they're agreeing to test their own employees. That will help us to exponentially increase the number of testing and to be and just like the Congresswoman said, that will help to provide some comfort to the workplace when these employers are agreeing to test their own employees at their own cost. So I'm excited about that. I hope other employers will do the same. If you want to open up, if you want to get back to business, then I think this is one of those things that employers, to the extent they're in a position to do it and financially can do it, this would really help to increase the amount of testing that's taking place. And lastly, what I will say, the reason I'm so much concerned about the testing, and then with what the governor said, because right down the street, for example, Montgomery County, the county judge in Montgomery County has said, well, the governor's order was somewhat vague, so he's opening up everything. He's not placing a 25% limit on restaurants, malls, or retail. He's opening up barbershops, salons. I mean, he is fully opening up. That's in Montgomery County. That's right down the street from the city of Houston. Do you know how many people in Montgomery County come in and out and work inside the city of Houston? The first case where there was non-travel related at the rodeo, that person lived in Montgomery County. That was the first case in the city of Houston that was not travel related. So I think we have to be very careful when we start talking about opening up. We are saying, let's be cautious, let's engage in social distancing. But the reality is, right down the street in Montgomery County, he's opening everything up, and those people are not staying in Montgomery County. They are coming right down I-45 into the city of Houston.
Doctor, let's ask you this question here. Governor Abbott said that he was making this decision with the direction of data and experience of doctors. You are a doctor. What is your take on this? Do you agree with that data that we are following to reopen this state? And if not, what would you recommend?
So, I think we were very lucky here in Texas. I think the reason we were very lucky is that we shut down quickly. So the best example is comparing Texas to Louisiana. The moment Mayor Turner decided that not to close the rodeo, even though it impacted greatly our economy, it actually stopped the transmission. While if you see in Louisiana, they left the Mardi Gras to go, and you see the numbers. So it's, we are complacent because we didn't see the numbers like we expected. I mean, we are behaving very much like what is going on in the San Francisco area, where we had a little peak and then it kind of stable. But even like that, our resources were strained in the hospitals, and we could take more, but you don't want to get there. There's also a lot of patients that haven't come who have decided to stay home because they don't want to get infected. So as we reopen, we have to be cautious. When you do things hastily, you actually slow down the progress. And even though people, what the mayor just said about Montgomery, people do come to Houston, and from there, and they travel back and forth. How are you going to know that those people are not infected? Or how are you going to stop? Because once it starts, it's like wildfire. It just spreads very quickly. And without a clear treatment or a clear vaccine in the next year, you have to be cautious and conservatively. Because what's going to happen if you open too quickly is that then you're going to have to do a very drastic quarantine that will hurt more the economy than going slowly. And that has been proven in history. So I think what, the Congresswoman Garcia, as well as Mayor Turner and Judge Hidalgo and Senator Alvarado, they all look at this, is that in our haste to open quickly, we might actually harm ourselves. And, I work in an academic institution where we see these numbers daily with very highly trained, and these are things that we have, talked about with, Dr. Shaw at the health department, Dr. Precy at the city, and they listen, right? And that's why we are very, very cautious. So we'll see what would happen in the next 2 weeks, and hopefully we won't have to regret opening so fast.
Okay. Congresswoman Garcia, a question here for small businesses. There's reports that big business got some of the PPP funds. What's being done to make sure that the small business owners are also getting some of these funds?
Well, we're unfortunately painfully aware that that did happen. I mean, when I saw some of the news reports myself that some publicly traded companies got $20 million or $10 million, and yet I've talked to a few of my own personal friends that are small businesses, and by that I mean less than 50 people, are still having trouble getting their loans approved. I was mad, quite frankly. And I think a lot of us were in Congress, which is why this last package that we passed just this Thursday, we actually set aside 60 billion of the total dollars, which is over 500 billion, to make sure that that money truly went to small businesses, minority-owned businesses, women-owned businesses, and that the dollars and the loans would be handled by local community banks and not just the national banks. So it's been a real eye-opener for me, quite frankly, as a new member of Congress, to just see how we may intend something and we may put dollars there to help the truly small businesses, but yet the agencies in their guidelines and in their procedures work it out so that it's really only the people that have existing banking relationships and have the wherewithal to get through this process, get the dollars. So we're working hard to make sure that doesn't happen again. We're even looking at a proposal to make sure that all the banks are going to be required to fund all the small businesses first and then fund some of the other larger businesses. So we're painfully aware. We're trying to get a fix on that. And let me just say that Texas is doing well in terms of the small business loans. We've gotten the most small business loans approved next to California. And I know in this next round, regrettably, we'll probably run out of money again by the end of the week. So I feel confident that sometime real soon, we're probably going to have to do yet a third round of SBA loan program because the need is there. And I think we need to continue the need, addressing that need until we're past the pandemic, much like we need to continue giving dollars to the hospitals, to individuals, and to the SNAP program, which is the food program, until this pandemic is over. It's all interconnected. We cannot just give dollars to small businesses. We got to take care of families. We got to take care of putting food on the table. And we got to continue working with the states on unemployment to make sure that workers get the dollars they need so they'll be ready to go back to work. So it's all interconnected. And again, working together with local governments, we can get it done.
Next question here for Mayor Turner. Jonathan says he's heard there's a number to call for homeless folks to get tested at mobile sites. Where should people go or call? Will there be transportation or service for that?
Yes, I will tell you that Yellow Cab and Metro are providing services for our homeless population to be taken and to get tested. Let me get my staff to get that number, and I'll have that number to you before we end.
Okay. All right. Let's see. I have a question here for the doctor. Make sure the mic's unmuted here. We've talked about flattening the curve. It's one of those phrases that we've heard a lot, but we haven't seen the curve lately. Can you give us an idea of what it looks like now here in Houston?
Yes, so it peaked around the midweek of April, and it's going like this. So we have the cases, and so it didn't do a big jump. So it just kind of gradually went in and then just been like that. So I can tell you from the Texas Medical Center, if you go to there's a webpage on the Texas Medical Center where you can see the daily cases. the number of new patients that we're getting in and the number of patients that we have in the ICU. So I can speak for the affiliates for Baylor College of Medicine. We haven't seen, it's as pretty steady. So if we have, for example, let's say, I think this morning we had about, in the different places, about 55 patients. And so it's a nice steady stream. We did see a little uptake at the Ben Taub Hospital and Harris Health. That has to do with testing. Also, our number of probable patients who have COVID had decreased because we had better testing that turned around. So the Gene Expert, it's a turnaround of a couple of hours. So you would come through the ER, get tested, and do that. So Baylor St. Luke's as well as the VA had those capabilities. So that gives us a waiting time less. But the patients that we've had new are kind of a steady stream, like more like drops. And that we like because we can take care of those patients instead of having, 20 patients coming at the same times who need ventilators or very sick.
So are we okay on PPE in Houston?
So I again, for the Texas Medical Center, the answer is yes. We get again, the Texas Medical Center has a webpage where you can see the amount of PPE that we have, and they go by colors, and we're green right now, as well as the number of ventilators and as well as the number of beds that are available at this time.
Thank you, Congresswoman. Question for you. President Trump has tweeted, and he said it repeatedly, we are doing a good job. Do you agree with that statement?
Well, regrettably, this won't be the first time I disagree with the president, and I disagree with him on this one. I just think that, frankly, if we again go back to the beginning, we started a little late. I mean, I think there were some indication that this may be a problem since about January. It was not acted on. I don't think we acted soon enough. Don't think we acted swiftly enough. And I think we're still not doing as much as we can, especially to support our states and to support our local governments. And fortunately for us in Houston, we've got Mayor Turner and Lena Hidalgo as county judge, who have had to step in. They've had to step in where the federal government has failed them. We in Congress did everything we could as soon as we could by stepping in to put the dollars in research and the SBA in the first bill. And then the second bill, we tried to take care of families and did the check program and the unemployment supplement and more dollars for hospitals and for the food programs. Then now we've done a third one, but we've done it piecemeal. But we could have started sooner, and as soon as it happened, we could have planned for it and taken care of all of it. So regrettably, I don't think he has done a good job. I think the White House has been a little cavalier about what they're doing. And when you've got a president who is suggesting that you can inject yourself with Clorox or some of these other things.
He did walk that back now. He did walk that back and say that.
Well, I mean, but he still said it, which tells you the mindset. And, you can walk back anything, but you said it. And that's what's so troubling. And when you've got a secretary of the Treasury who thinks that $1,200 is enough for a family and enough for one time, I think they need to focus on people. They need to make sure that people are taken care of, people are hurting, and we need to address those needs. People want the food on the table. They're nervous about their jobs. But the thing that they are scared about the most, and I've seen a poll recently that even indicates that, they're scared that they may get the virus. They're scared that a loved one may get the virus. They're scared that if they get the virus, there won't be a hospital or a test for them. They're scared that they won't have the access for treatment. Those are their biggest concerns, and we need to address that. The health issues will drive what we do for the economy. You can't put the economy before the health outcomes. It doesn't work that way. And the mayor's right. We got to make sure that we can take care of people before we have a full recovery. And we've got to fully address that. And again, it's about tests, tests, and tests. And in case y'all didn't hear me, it's about tests.
We've heard it from all of you this evening. Thank you all so much. We have probably less than 4 minutes here. We have to wrap, and I would like you to make some final comments, beginning first with the doctor. We know that businesses are going to reopen, begin to reopen. Please let the public know what they can do to protect themselves.
So wear the mask. That is definitely, it's a way of preventing. If you cough from one person to another, we wear the mask. We wear them every day here in the hospital to take care of you. Wash your hands. The washing of your hands, those 20 seconds with soap and water are miraculously. Social distancing, as I've said, for us Latinas, is very hard because we are huggers. We like to be, but we're going to start, we keep our distance. And disinfecting the areas, and be conscious that you might be healthy, but you can carry it to someone else who might actually not do us so well. So
Right.
It's the same thing that we've been saying in the last, 4 months or 3 months.
Thank you so much. Mayor Turner, your final remarks?
Look, let me just say we've done very well in the city of Houston. It is important for us to continue what we have been doing. And that is staying home when we are working, to work very safely, to engage in the social distancing, to wear the face covering. All of those things have proven to work. The Kinder Institute at Rice University, they did a study, and the results of their study came back that because of the things that we've done collectively, thousands of lives have been saved in the city of Houston, and that's because of our collective effort. Let me just say this, for those who want to be tested in the city of Houston, if you'll call 832-393-4220, 832-393-4220, and then the people there will be there ready to assist you.
Thank you so much. Senator?
Thank you again for having us, and again to the Congresswoman, thank you for organizing this. Mayor, we very much appreciate your leadership and all the recovery efforts. I want to also mention a couple of sites to go to. We know that our kids are home, and there are some families that do not have access to internet. If you would like to find the nearest hotspot, this is supplied by Xfinity. We urge you to go to hotspots.wifi.xfinity.com. We also know that computer equipment for our students is a necessity. There is an organization, CompuDot, that I'd like to give the website so people can go and possibly request to see if there are any computers available, but that's compudot.org/COVID. Again, I wish everyone a very healthy rest to this stay-at-home order that we have. Please listen to your officials, listen to credible sources. If you'd like to reach us, we are at carol.alvarado@senate.texas.gov. Thank you.
All right, Congresswoman, final remarks?
Well, I know that my colleagues, first of all, thank you all for joining us, and the good doctor, thank you for joining us. And Mayor, you're doing a super job. Keep it up. And we're here to support you, and we're going to try to give you all the flexibility that you need to get the job done here in Houston. If anyone has any further questions, we're running out of time. My number is 832-325-3150. And like the mayor, I want to thank everyone for doing their own individual part in listening and following the orders and staying at home. That's taken us a long way to get to where we are today. And I would especially thank the doctor and all the healthcare workers, all the frontline workers, everybody from the store, grocery store workers to the people who come after the doctor, the custodians, the janitors, the people who clean their offices and make sure they're ready for work, because it takes all of us working together. So thank you all for doing what your part. And I know in my heart that we will get past through this, and we will, because we always know how to work together, and we know what it takes to weather a storm, because we've been through many. This is just another one, but I know we can get through it. So thank you again for doing your part. And with all of us working together, we can get through it. So God bless and good evening.
Thank you all so much. And thank you everyone out there watching. On behalf of these fabulous panelists, we thank you for tuning in for this coronavirus virtual town hall. Be well, stay safe. Everyone have a good night. Thank you.
Thank you.